There you are. There you are. There's a smile. Hi. You're doing so good. You came to see me again? That is so awesome. Just hanging out? You just hanging out? So this little one, y'all, how old?
4 months.
4 months old. Friends of ours, when we had the big storm in Portland, Oregon, which was a couple weeks ago, you guys lost power. We lost power. You had a wood stove, so you could cook. So we went over for breakfast, and oh my gosh, it was the best breakfast. But you weren't feeling very good, huh? She looks so much better now. Yeah. So maybe share with our viewers sort of what had been going through your household and then where we were at that day.
Yeah, definitely. So my older kids had been sick. In fact, my oldest got sick 2 days before Christmas. So this crowd had been moving through our house for a couple of weeks. Big sister got sick. A week later, big brother got sick. And then she had just been starting to really not feel well that last day or so. She was on day 1 or 2 of a fever. And she ended up having a fever for 4 days. She had diarrhea for 3 days. And she was starting to develop a little bit of a cough, not too concerning. Monday, we ended up going over
you got a lot
to my
to
in-laws.
say.
She does.
That's
we ended up going over
great.
to my in-laws' house because we still didn't have power, and I was like, she's getting this little chest cough that her siblings had, so I thought we might need access to hot water to do steam treatments. It was too cold to take her outside, these things that you typically do for respiratory stuff. And so we went over to my in-laws, and that afternoon she just was really struggling to nurse. She's exclusively
you have a lot to say.
breastfed. And I was starting to get concerned because she was just getting really sleepy. She was struggling to eat. She was still having a lot of diarrhea. Her fever was getting higher. It was between 100 and 102. And so that night, we ended up deciding to take her into the emergency room in Newburgh.
Okay, let me have you pause.
Yeah.
So, Dr. Paul here, but I am retired. I don't diagnose or treat. I'm not licensed. We were just visiting family friends. And the whole purpose of this particular video is information, right? One of the big challenges for parents with a baby especially, but kids in general. Hi, you have a lot to say, don't you? You have so much to say. I like that. Were you agreeing with Mommy in her story? Yeah? I thought you were. You were just trying to interject some other facts, huh? So, one of the challenges for parents is, when do I go to the emergency room? And that was actually something we kind of discussed. Obviously, I wasn't diagnosing or treating, but I've been a pediatrician for 35 years, and sick babies is kind of my wheelhouse. And if you've got a family member or a friend, even if you're retired, even if you're not licensed anymore, you're still going to give them information. So I thought this would be information that would be helpful for a lot of parents out there who might have a child who's sick. It is winter time. And that big question of, well, when do we go to the emergency room? So I remember at that point, a little bit of a cough, breathing a little fast, but still able to nurse, right?
Yeah.
So feeding was okay. It's interesting. You had called us just to invite us over for breakfast and mentioned that she was a little sick, and you didn't know if you should go to the emergency room. And I remember when we were first talking, I'm thinking, maybe you do need to go to the emergency room, but that was over the phone.
Right.
And as soon as I arrived and I saw this pretty baby, you were smiling still, able to smile, able to nurse, and you weren't breathing too fast. No, you weren't. You were breathing just a little fast. Just a little fast. So in infants, if they're breathing at, say, 60 breaths per minute, that's 1 per second. That'd be like 1,000, 2, 1,000. At that breath rate of 1 per second, 60 breaths per minute, that's about the point where most babies are going to start to drop their oxygen. And so if you're home at home and you're wondering, are they short of oxygen because they are sick, right? And they're coughing. Yeah. That would certainly be an indicator that, we might need to go be seen. Other things that indicate that would be they can't nurse anymore, right? You try to latch them, they'll go sucking and gasp for air. You know, that can happen if your nose is plugged. So sometimes you gotta make sure the nose is okay. Yeah, you sure do. Yeah, you look so much better. Don't you? You feel better too. What do you think? What do you think? Oh, you have a lot to say. We could talk all day. Gosh, I love babies. So at that point, we were thinking, hang in there, see how it goes. Things probably changed a little that got you a little nervous.
Yeah.
So you ended up going to the emergency room. What do you recall? What do you recall as what changed that made you decide to go to the emergency room?
Yeah, it wasn't even so much her breathing. It was more the fact that there seemed to be an increase in diarrhea. We still had fever. And then she was starting to not really nurse. Like, she would latch and then just come off. And she was very sleepy. Like, she slept most of the afternoon. When she was awake, she was extremely fussy and wouldn't smile. Just seemed not quite at the point of lethargy, but at the point where I knew we would probably get iced in up where we were. And I knew if it got any worse during the night, we might be in a bad place. So I thought it wouldn't hurt to get her checked out. And that was our option that day.
Yep. And there you have it, folks. You hear the story of not feeding as well, of diarrhea, which is going to make you more and more dehydrated. So if you're not feeding well and you've got vomiting or diarrhea or both, and you're this little, hey, you're this little. She's looking at the picture on the ceiling. If you get dehydrated and then also not smiling, right? So your baby's acting sick. I absolutely think that those were the right signs to just, you never want to go to the emergency room if you don't have to.
Right.
But we did have an ice storm coming, so I don't blame you one bit. So tell us what happened in the emergency room.
So we showed up and we were at Providence Newburgh. They were actually really great. So they did a test for her, testing for flu, COVID, and RSV. And the RSV came back positive. They checked all her vitals. They then had us go wait for a little bit, not as long as I was expecting. And then they took her back. They watched her for a little bit, took more vitals, and I had let them know. She tried to nurse a couple times while we were there, but still just would pull off and be really upset and not eat a whole lot. And then they decided at that point, we may want to talk about Tylenol and some anti-nausea medication. In her case, the odinestrine, whatever it's called, the generic for Zofran. Ondansetron. They asked us if we'd be willing to do that. They also asked about doing a chest x-ray, and they listened to her lungs and said they didn't hear anything lower respiratory, so I asked if we could wait on the chest x-ray, and they said that was fine.
Okay. And
that they were actually really amenable and respectful to being like, it's okay if you want to hold on some of these things. We do recommend the Tylenol and the Zofran. And then they said, we're going to suck all the snot out of her nose. They had a machine where they did that.
A little snot sucker.
Yeah, an electric one, which was interesting. And then they had me give her the Tylenol, which I don't love, but at that point I felt that the benefits outweighed the risks because of how in pain she was. Yeah. And then the Zofran, and they had us wait 30 minutes, and they said if she's going to be able to nurse okay, then we're comfortable talking about what it might look like to release you. If she doesn't, we can talk about next steps, potentially IV fluids or something of that nature.
Yeah.
And she ended up nursing okay. She still had a fever. Her fever actually increased a little bit while we were there. She had a 102-degree fever still when they released her, but she was acting much better, nursing, she was smiling. So they sent us home with a prescription for the Zofran and Tylenol and said to maybe keep her on that for a day or two just until she was nursing reliably well.
Perfect. Was she vomiting?
A little bit, but she's a little refluxy at times.
Up anyway.
She does.
Yeah, it's hard sometimes to separate vomit or spit up from a baby this age. If you have a little bit of what you called reflux, which is what we call it, gastroesophageal reflux. Food goes down the esophagus into the stomach, and there's a little muscle right there that keeps it from coming back up, and that muscle's kind of loose for babies, and so on a full tummy, or even not that full of a tummy if they're laying down or over jiggled, out it comes. Do you remember what the oxygen was at the emergency room?
It was, I believe, 98.
98. Okay, so that's a perfect oxygen. Just knowing that, the only other reason you would have needed to stay would be dehydration.
They did say she was mildly dehydrated.
Yeah, so that's what they were worried about, and that's why they wanted to make sure you could do a feeding, and that was why you were able to go. I mean, feeding happened, oxygen was fine. So yeah, even though it's hard to know as a parent, right? It's hard to get. Some of you may have a pulse ox at home. They sell these little boxes where you just stick your finger in it and you can measure your oxygenation. And you can usually make that work even on infants, but it's really hard when they're little because it has to pick up each heartbeat, and little babies have really high heartbeats, and they have little tiny fingers that may not reach the probe that's sensing those heartbeats. So it's like boom, 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 and you need to see that moving each time. So, oh, you're listening. Yes, you are. That's what we tried, and I don't think it worked too good, huh? No. But now we know. We knew once you went to the ER that you were going to be fine. Yeah, so you had a great episode of RSV. So RSV stands for Respiratory Syncytial Virus. And folks, I have seen thousands of cases of RSV. And yes, we have. So it's a really predictable course. You get a little cold-like symptoms. Occasionally you can have the intestinal stuff, the vomiting, diarrhea, but usually it's more congestion, cough, upper respiratory stuff. And kids tend to get worse for the first few days for up to about a week. They tend to then plateau at their worst, kind of good, looking good and not so good, depending on how congested they are. And then they get better over the next week or two. Total illness is thought to be 2 weeks, although I've seen it last a month. And so you've been hearing in the news that there's this illness that's lasting forever, like a month. Well, most likely RSV's involved, but also, ooh, you're ready to scoot. Look at that. You're ready to scoot. That's impressive. That's impressive. You can get more than one thing. So every winter we have flu, we have rhinoviruses, cold viruses. We even had coronaviruses before COVID-19. It was just one of the causes of the common cold. And of course, one of the reasons when your baby's in distress, you go to the emergency room is in case it's a bacterial infection that you can treat. And so especially when there's highish fevers, which, for a 4-month-old, 102 that's impressive. The younger babies don't necessarily mount a super high fever. So, yeah. But what I wanted to say about RSV is, in all my years, worst case scenario, we're talking in 35 years, no deaths. Handful of hospitalizations when I was super busy with, over 15,000 patients in our practice. Each winter, we would probably end up with 1 or 2 in the hospital for either hydration or oxygen support, the 2 things you went to the hospital for. And, you dodged that one. And that's true for 99% or more of babies who get RSV or children who get RSV. It's just a really bad cold or a mild cold. And but the congestion and you can even get an RSV pneumonia, which is, it's sort of a combination of the virus and your immune system, white blood cells trying to fight the infection, can cause what we call pneumonia, which is fluid in the lungs. And in an RSV, oh, you're gonna eat my finger? You gonna eat my finger? I'm gonna give you your own finger to eat. Yes, I am. Generally, the pneumonia of RSV or viral pneumonias are just sort of a speckling around the entire lungs, whereas some bacterial infections will be just boom, locked in one area of the lung. So that's where either you can hear that sometimes, or in a really sick kid you might get a chest x-ray, which is why they offered that. But thank you for sharing your story.
Yeah,
I think this will be super helpful to people, and I wanted them to be able to see a little baby who really was pretty sick. Yes, you were. Awfully cute though, no matter how sick you were. Yes, you are. And just to reassure you that you don't have to rush to the hospital unless, remember, really rapid breathing, struggling to breathe so much that you might need oxygen. If you happen to get a pulse ox that works and you're over 93%, 92, 93, it's not time to go to the hospital based on the need for oxygen. And then the other thing to watch for is the dehydration. And when babies get dehydrated, they're not urinating as often, so you might only pee twice in a 24-hour period. That's not okay. We need at least a couple pees in 12 hours to just feel confident that it doesn't have to be a lot, but just a little dampness in the diaper that we're still making urine, we're not too dehydrated. Heart rate goes up when you're dehydrated. If it gets too high, combination of fever, sick, and dehydration, another factor that makes it difficult to oxygenate. So anyway, thank you for watching, and thank you so much for sharing this amazing story and this beautiful baby. Oh my gosh, what a treat. Take care.